Thank you so much for joining me on this podcast today. We're going to be talking all about the hottest topics in cosmetic medicine. I'm joined by dermatologist Dr. Emily Levin. We'll introduce her in just a second. But today we're going to talk about some hot topics that I think you're going to find really, really interesting. We're going to talk about what cosmetic procedure a plastic surgeon says turns your face into a melted sandwich. Yes, he says a melted sandwich. We're going to talk about Ozempic penis. Ozempic penis, yes, that's, I guess, a real thing. We're going to talk about Khloe Kardashian, who has basically explained what she has had done. We're going to talk about a decline in certain cosmetic procedures and a whole lot more. So I'd like to introduce my guest this week, Dr. Emily Levin. If you listen to this podcast, hopefully you're very familiar with her. Nice to see you.
Nice to see you.
So for those people who aren't acquainted with you, if they're maybe new to the show, can you explain what you do and where your practice is?
Yes, I am a board certified dermatologist. I am in private practice in the suburbs of Detroit, Michigan. I have been grown up and raised here in the Detroit area, and I practice general dermatology with a focus on cosmetic and surgical dermatology as well. And we have 2 locations to my office, which is great.
Great. So I have Dr. Emily Levin here every so often where we talk about hot topics because I think it's really interesting to get the opinion of both a plastic surgeon and a dermatologist. Sometimes we disagree on stuff. We come from different trainings, so I think it's interesting that way. Yeah. So what's new in you and your practice?
What's new? Well, right now it's tick season in my practice, so we see a lot of ticks right now, and oftentimes people think they're changing moles, but it's really an engorged tick. Not to gross out your listeners here, but yeah, those are kind of fun to little squirming ticks.
So they come in and they say, "Oh, I've got a mole here that's new," and you look down, you're like, "Oh my God!"
I have a changing mole. I think I have a changing mole, and they show me on their stomach or on their back where it is. To be fair, sometimes places they can't see very well. And
wow.
Yeah, it's an engorged tick that's been there. I said, how long has this been changing? About a month.
So they have this tick sitting on their skin for a month?
Yeah. And it's heavily engorged and embedded, and so I have to numb it up and like pluck it, and I actually usually just cut it out, like I do a little shave removal.
You do?
And when you numb it up, the legs kind of flail, and ooh!
Oh my!
It keeps my job very interesting, Tony.
How long can a tick be like attached to somebody like that?
That's a good question. I think indefinitely, eventually, maybe once it's engorged enough, it'll fall off.
Oh my!
But you have to worry about Lyme disease, so we always treat these patients with an antibiotic that treats Lyme disease for 30 days just in case.
Yeah.
It keeps my job interesting. There's been a lot of them lately. One was in someone's hair. They didn't know. They don't know.
Supposedly it's just the deer ticks that carry Lyme, is my understanding,
correct,
right?
Correct.
Do you look at them and be like, oh, this is a deer tick, this is not, or do you just treat everybody just as a precaution?
I treat everybody just as a precaution because if it was me, I don't care what kind of tick it was, just in case, I'd want to take the antibiotic. It's a pretty benign antibiotic, but we often will send it. We'll send the tick in a biopsy jar to the pathology lab, and maybe they have an entomologist, I don't know, that would look at it, and they'll send back identification of the tick.
Those patients must be just horrified when you tell them this is a tick.
They are horrified.
Wow.
And my staff is often horrified, but in a fun way. Like, we think it's fun. I'm not fun for the patient, but it keeps, it's an interesting one. It's not the typical dermatology day, but we've been seeing a lot of ticks, embedded ticks lately.
Oh, that's just horrifying.
So that's a fun day at our office.
Well, speaking of deer, we were talking before the podcast that we just got back not that long ago from Japan. And one of the coolest things that we saw there is a town called Nara. And Nara is a town where the way that they describe it, deer are basically sacred in this town. And the town is filled with these small deer. They're maybe 3 feet tall at the biggest. Some of them have antlers. Some of them have a full rack of antlers. And the crazy thing about this town is that these deer will come up to you. You can pet them, and they will some of them will actually bow to you.
Wow.
So they come up to you, you bow to them, they bow back to you. Now, they do sell these like wafers. And they bow to you because they want you to give them a treat, essentially. But some of them will bow. You bow to them, they bow back. You bow again, they bow back.
That's fascinating.
And then you give them a treat, and then all these other deer will see that you're feeding them, and then they'll come running after you. And if you have treats in your hands, and let's say you turn around and you start trying to walk away, some of them will actually go and they'll bite you in the butt.
Really?
Yeah, they won't like bite hard, but they'll like bite your butt to like get your
it.
attention.
Oh my goodness. Well, that is on our list to go because we're planning to go to Japan too.
It is really worth going.
I would. Okay.
It's so much fun. And it's so fun because you'd see some tourists who don't know what to expect, and they got a whole handful of these treats, and they don't, and these deer come up to them, they don't know what to do. And you see some of them like drop it and throw it and then go running away. But they're really cute. I mean, the deer are just cute, and you could just stand there and just pet them.
I love it. As an animal lover, I love that. I'm going to enjoy
great.
that.
Yeah, your family's going to love it when you go. You're going in December, right?
Yeah, in December.
Well, today we're going to cover some pretty interesting stories here. And some of these I think are fascinating because they are kind of the latest updates in certain cosmetic procedures. But the first one I'd like to talk about is an article, and it's titled, "I Reversed $150,000 of Plastic Surgery and Turned to Biohacking." A mom of two who spent around $150,000 on plastic surgery says she's aging in reverse after ditching fillers and Botox in favor of biohacking. And she now gets mistaken for a 17-year-old. And she's 37. Over nearly 2 decades, Tracy has had 5 breast augmentations, chin liposuction, an upper eyelid lift, a rhinoplasty, a Brazilian butt lift, labiaplasty, and teeth straightening. She also got Botox and fillers every few months, plus other beauty treatments like semi-permanent makeup touch-ups and eyelash extensions. But now she's committed to a radical new regime, biohacking. Biohacking is a method of slowing down the aging process by hacking your body's functions through advanced technology, such as oxygen chambers and infrared therapy. It's a growing trend popularized by U.S. tech millionaire Brian Johnson, who made headlines for his extreme anti-aging routines, including receiving blood transfusions from his son. Tracy undergoes weekly sessions in oxygen chambers, infrared therapy, and something called human regeneration to decrease her biological age. She spends between $640 to $1,280 per week on treatments. Various biological tests have shown that her body clock is a full decade younger than her actual age. "I also use a human regenerator, which basically uses atoms and ions to naturally renew cells in the body," she said. Her daily routine includes drinking adaptogen coffee, hanging upside down from a pull-up bar outside her house for better blood flow to the brain, infrared sauna therapy, oxygen chambers, and time in the human regenerator. She also follows a strict vegan diet and avoids processed foods entirely. Now fully vested in her biohacking lifestyle, she describes herself as superhuman. "I would absolutely describe myself as superhuman," she said. "People think biohackers are conspiracy theorists in tinfoil hats, but it's actually the opposite. It's legit and it works." So have you heard much about biohacking? Is this something that your patients talk to you about as far as some of these biohacking treatments?
So I've never heard the term biohacking, but they've asked me about several of these treatments, in particular like red light therapy or infrared light therapy, that kind of thing. You couldn't, I don't know if you were looking up, I was rolling my eyes over here when you were reading that one, because when I read this article, I'm rolling my eyes at the article because it just, to me, she's 37 years old. If you can see the picture of her, she looks young, but she looks like she's 37 years old. And I ran this one by my staff yesterday when I was reading it. But what's interesting to me, so people ask about these treatments all the time, not the biohacking term, but she had all these things, fillers, Botox, facelifts, all these things, and then decided to stop and, switched over. She must feel great with her vegan diet and her non-processed foods, and I'm sure, but, she still looks youthful from a lot of the things she's had done. I think, she didn't take it all away. So this one was I don't know, I was the cynic on this article a little bit.
The quote unquote father of biohacking, I'm friends with him. His name is Dave Asprey. And he was the one that started Bulletproof Coffee.
Okay.
And he's written books on biohacking. He's got a biohacking conference every year. He actually invited me to be a speaker there a couple years ago. And I decided, I think at the time I couldn't make it or something like that. But the way I look at biohacking, and some of the things make sense, like infrared sauna. I have an infrared sauna. We love it.
At your house, you have one?
Yeah, we do.
Okay. So that's my question: do you do these things?
So we have an infrared sauna, and there's real data out there showing that if you sauna regularly, that all-cause mortality. Supposedly, if you do like 2 to 3 times a week, you reduce all-cause mortality by like 40%. Like it's crazy.
And is it the infrared or the heat?
It's both. So it's infrared, which is going to be detoxifying, and it doesn't go as hot as, let's say, a steam sauna. So ours goes, I can get up to about 140. And the idea is that you are detoxifying your body. You're sweating out the toxins and all of that. And you're also putting yourself under some stress. So you get heat shock proteins. And the idea in general with some of these things is that you stress your body in a controlled acute fashion and your body reacts to it by actually increasing longevity. And it's these lifestyles that we have that are just comfortable all the time that will actually reduce your longevity because your body is not used to being stressed that way. And so anyways, but the problem is that, the way I look at biohacking is that biohacking are basically people who are taking these types of treatments that haven't been proven yet, and they are doing it before they get proven. And typically these are treatments that are not medical grade because, otherwise the FDA would have to clear them and all that type of stuff. But these are treatments that are not quite medical grade, so they're not quite as powerful, but people do them. They spend a lot of money doing them. And there's all different types of biohacking, people standing on vibration plates when they work out and things like that. And in the end, the way I look at it, it's kind of like a lot of the treatments that we see cosmetically is that there are these devices that get tested, they enter the FDA approval process, and some of them don't make it through.
Right.
And we don't use them because we're like, this isn't going to work.
Right. And they're expensive.
Yeah. Well, for example, the company that makes Daxxify, Revance, they had a topical botulinum toxin
I remember that.
for a while. And that never got FDA approved, so we never used it because it apparently didn't work.
Yep.
So the way I look at biohacking is that they take these devices that may have like a semblance of truth to it, of like, oh, that can possibly make sense. And then people get these done, they spend tons of money doing it. And yeah, maybe one or two of them may actually eventually work in the long run, but the others eventually get shelved aside because people eventually realize that they're not really doing anything.
Yeah. And I think there's kind of a limit or a line a little bit. Like I always think personally, what would I do? What do I believe and what would I do for my own body? And what do I do for my own body? And that's what I always would ask you and I did start drinking this mushroom coffee, this adaptogen with all that, because why not? I mean, if it could be good for you and it's kind of like a little soupy mushroom broth for me before dinner and it makes me feel kind of, great. Like it can't hurt. It's a good thing to snack on before when I get super hungry in the afternoon. I do hot yoga under infrared lights, several times a week where I sweat.
Well, that's
so
like
it's almost like
thing.
It's almost like.
But that also is actually there's science behind it. And those are like something like that. It's like, acupuncture, like that's something where there's true science behind it. Studies show it actually works. Now we don't necessarily can't explain why it works from a Western standpoint, but it does work.
It does work.
I think with biohacking, now what happens is you get these devices, people buy them and, they're like laser helmet things and visors and all this stuff. And the fact is, I think people have fun doing it.
Yeah.
Because they feel special and like, I'm a biohacker. It's become like a term that you use now to describe yourself. And for some people that's like and I have friends of mine who are like that. That's like a term that they feel, proud of, like, oh, I'm a biohacker. I'm like, oh, okay. All right, whatever. But for me, I think those treatments essentially are treatments that are not proven yet. And, maybe 70, 80% in the end may not, eventually they'll fall by the wayside because they just don't work. But the other maybe 20%, 30% could end up being like red light masks where, biohackers are doing red light masks way before we were.
Yeah.
And now they're becoming more mainstream because there's science to show that those things work.
What did you think about the bioregenerative machine with the ions?
I don't know what that is.
Okay, me neither. I tried really hard to look into what that was and what the atoms and adjusting.
But that's probably one of those things where it's like you try to look for studies for it. There's no studies.
Nothing.
Probably there's just this idea of, oh, it does that. And
it looks like an expensive machine. Did you see it? It looks like an MRI machine or something. It's like really big.
People are spending a lot of money on these things. That Brian Johnson's interesting because he's basically just a guinea pig to try all these things to see if it makes him younger. But he also gets work done. Like he gets injections. He's had Sculptra and, I think he's had Botox and he's obviously had surgery and stuff. So it's like,
well, good for her. And honestly, I agree. I agree with the vegan diet and the non-processed foods. I mean, these are all good things for your body anyway, and very well proven.
And doing that can reduce your biological age anyway.
Exactly.
And I'm sure she's exercising regularly. All that type of stuff will do it. So, so for those of you who are watching, you're like, well, geez, what do I do? One tip I have is my book, Younger for Life, has got, basically things that are proven to help with that type of thing, with the diet, with the, activity, with de-stressing, as well as cosmetic treatments. And by doing all that, I think that's a good starting point. And then if you want to add some of this biohacking stuff for fun, then nothing wrong with it. It's probably not, harmful. It's not true medical grade stuff. Just keep in mind that you might be spending a lot of money on things that in the end you may toss out and be like, yeah, this never worked.
Didn't really work.
Yeah.
Right.
Well, speaking of something that we know works, but maybe we didn't expect would work like this, there's an article on Ozempic penis. Male users reveal shocking change to their genitalia after injecting weight loss shot. Male Ozempic users say their penises have gotten bigger since they started injecting the weight loss shot, with dozens of well-endowed fellas flocking to online forums to fawn over their expanded members. I recently measured myself down there and noticed I gained about 1 inch, an anonymous user recently claimed on a Reddit thread. Some men also admitted that they had noticed a size difference after taking Ozempic, but they put it down to better blood flow and reduced fat around the pubic area. The phenomenon, dubbed Ozempic penis or Ozemdick, is just the latest in a series of side effects users of the weight loss drugs have allegedly experienced. Ozempic mouth is another reported side effect marked by pronounced folds at the corners of the mouth, noticeable wrinkles on the lips, and sagging skin along the lip contours and chin area. Those alarmed by their changed appearance are now turning to cosmetic treatments such as dermal fillers to restore lost volume around the mouth area. Dr. Levin, you're a dermatologist. How many of your patients have asked you about Ozempic?
Ozempic. Not Ozempic. I don't get that one. I've gotten an Ozempic face, and I get that a lot. We get a lot of people coming and requesting what they were calling Ozempic mouth, but the loss of fat and volume in the face.
So have they actually said Ozempic mouth?
They've never said Ozempic mouth. They've just said Ozempic face, my Ozempic face, my GLP face or whatever they're terming it. Because there is a lot of, there is definite fat loss and volume loss in the face from going on these GLPs.
Oh, yeah.
So I've done a lot of fillers, with patients for this, or I refer to a plastic surgeon like you to just do a facelift if they need enough. But Ozempic, I have not had.
So what do you think is going on with Ozempic penis?
I think that person's assessment is pretty accurate. My guess is, obviously there's probably a lot of, fat that's around that area, certainly in the lower abdominal region and possibly in the pubic region and inner thighs. And then when you lose all that fat, the actual member looks bigger and maybe increased blood flow. There was a doctor in there, I think, that said, there's really no research to suggest that Ozempic makes, a penis larger.
Yeah.
But if everything surrounding it has gotten smaller, why wouldn't it look larger? So if that's what
I
men
agree.
wanna
think that's
great.
what's going on. And I made a video on my YouTube channel a year or two ago, and it was like how to make your penis bigger. And you can do things like inject filler. I've never done that. I've never seen it. I know some people are actually doing that.
Nor have I.
You can do things like you can actually cut the suspensory ligament to the penis, and that lengthens it, I guess. But now you've got some instability potentially afterwards. Or you can literally liposuction the pubic area above the penis, and that will help make it look bigger.
Yep.
Or longer, because just like I think what's going on here is the mass around it starts to get thinner, and it seems like it is more projecting, I guess. And so also shaving down there could potentially help because it, once again, hides it and makes it look like it's sticking out. So I don't think there's anything in Ozempic that will truly cause your penis to be longer, but I would agree with you. I think what's going on is everything around it is getting thinner, and I don't think there's any fat in the penis.
Not in the penis, but certainly in the pubic area around it.
Yeah, but there's no fat in the penis. So if you lose weight, your penis is going to stay the same size, but then everything around it's going to get smaller, and I think that's what they're noticing.
And they talked about the measurements at different points of possible erection-ish, situations in that one as well. But yeah, I agree with you. I think I do like the term. That's a fun term.
But they're gaining 1 inch to 1.5 inches.
Who's measuring
that's
this?
They are measuring themselves.
How specific is the measurement?
Guys do that. Guys will measure.
This is something I won't understand.
Yeah, I don't do that. But supposedly guys measure it. I've heard Justin does that every 6 months. Every 6 months, Justin
under the
measures
bus you've
himself.
been thrown, Justin.
All right, so for all of you listening,
do you measure your penis, babe? I'm going to ask my husband when I get home. This will be
your
good dinner
husband
conversation.
When the last time he measured the length of it was. And I guarantee you, if he's measuring it not when it's flaccid. Because,
exactly.
Yeah. Men will only measure it when it's not. Anyways.
It's a good one.
Okay, so we'll go to the next story here. Khloe Kardashian names every cosmetic procedure she's done. I know some great doctors, she said. This is from USA Today. The reality TV star and media mogul, 41, opened up about her history of cosmetic procedures in the comments section of a June 28th Instagram post. Following her appearance at Jeff Bezos and Lauren Sanchez's Italy wedding, Kardashian received a shout-out from Dr. Johnny Betteridge, a London-based esthetician who praised her as the standout face from the celebrity nuptials. Betteridge, who said Kardashian's physical appearance has changed a lot over the past few years, speculated that the Kardashian star transformation likely included cosmetic procedures such as a temporal brow lift, a rhinoplasty, lip filler, and a face and neck lift. The following day, Kardashian responded to Betteridge's assessment by confirming the cosmetic work she's had done in a detailed list, including the doctors and service providers who oversaw her procedures. I take this as a great compliment, she wrote. So these are the things that she said she had. A nose job by Dr. Raj Kanodia, laser hair removal for the hairline and everywhere else, Botox and Sculptra, soft wave laser treatment for skin tightening, dermal fillers, collagen baby threads treatment for the chin and neck, and salmon sperm facials and peptides. Kardashian previously opened up about her relationship with body image, including her explorations of plastic surgery in the June 2021 reunion for Keeping Up with the Kardashians. Kardashian revealed at the time that she'd had a nose job as well as unspecified injections. When the show first started, I was very secure, Kardashian said. Then, during the first couple seasons, I became insecure because of the public opinions of myself. Then I had a good run of being secure. Then recently I become now insecure again. So I guess it just goes up and down. What do you think about Khloe Kardashian telling us this is what she's had done? Do you believe that? And what are some of your thoughts of the treatments that she's had done?
Yeah. Well, first of all, I love it that they're talking about what they've had done. Then Kylie talked about her breast implants. We talked about that last time. I love it that they're being open and honest, that they are having work done, what they're having done, and great. They're giving shout outs to the people that are doing it for them. I think that's great. And it sounds like what she's having is very reasonable for her age. And there's a lot of the things we do, you and I do it around the age she is. I think she's around 40. And she looks great, albeit, like she's had stuff done, but I think she looks great. It's sad to me a little bit. Obviously, there's a little bit of kind of a conundrum in that article because she's like, this insecurity of just being in such a public image and whatever. But at the same time, I mean, people, women, young girls especially, and women look up to the Kardashians and want to emulate their appearances. And so I really think it's great that they're saying, we have had stuff done. We don't just look like this naturally. This is what we've had done. They clearly have a lot of, time and finances to be able to spend on that.
Yeah.
And I actually thought that was a great article. I was really happy she talked about that. I think she's doing good things. We've talked about threads before, and they can be kind of hit or miss.
I'm not a big fan of the collagen baby threads treatment. I feel like that doesn't really work very well.
I don't know what soft wave is. What's the technology of soft wave?
Well, soft wave is basically a bipolar ultrasound skin heating. It's the new whatchamacallit? Ultherapy. Yeah. It's not Ultherapy though. It's their competitor. But it's ultrasound. Right.
But is it the two-pronged one that one prong goes under the skin?
It doesn't go into the body.
Oh, it doesn't. Okay.
No, it's completely non-invasive.
Okay.
We actually covered it. For those of you wondering, Softwave, we covered it with Dr. Adam Rubenstein in a podcast a few weeks ago. But what this is essentially is they describe it as bipolar ultrasound to heat the deeper skin to try to create tightening. And supposedly because of the bipolar nature, it's not as painful as Ultherapy. This is how it has been billed. I don't have any skin in the game. I don't have either device, but that's how they bill it. And there have been some prominent dermatologists who I know. My friend Doris Day, she's a big fan of Softwave.
Okay.
Yeah.
That's good.
Yeah.
Okay.
So,
well, I think it's good. What do you think of it? I mean, I think it's good that they're talking about these things and acknowledging and admitting instead of being defensive. And
I think it's great because here's a guy who says, oh, you've had a temporal brow lift, you had a rhinoplasty, lip filler, face and neck lift. And she came back saying, I take this as a great compliment, which is like, wow, because usually celebrities would come back and get upset and be like, I didn't do anything. It's all olive oil. That's all I'm doing for my, all this, but the fact that she would come back and say, hey, actually, this is what I had. And I'm sure because she named exactly where she had these treatments done, the laser centers and all that type of stuff, which really helps those companies. I mean, doing it. I mean, hey, if she was your patient and she did this, like, holy crap.
Thank you, Khloe. Yeah.
So, I mean, you got to hand it to her. Interesting, another celebrity who's been very upfront that she's had work done and recently had a forehead shortening surgery DM'd me actually a couple weeks ago, Chrissy Teigen. DM'd me out of the blue just to follow up with me because I think I did a post on it, and she was very nice, and she was like really, really nice about it, and so we were DMing back and forth and stuff. And I think I really, hand it to these celebrities, especially the female celebrities where they're under a microscope and there's so much pressure to look a certain way, and then for them to come out and be very honest with the stuff that they've had done, I think they're doing a public service.
I agree.
Because you have all of these followers of theirs who don't know what they've had done, and some of them who may assume that they've had nothing done and that they just look this good naturally. And so I think that especially women, a lot of young women think, oh, well, I should look that good naturally. And why don't I look as good as the Kardashians?
Exactly.
And by putting this stuff out there, I feel like Khloe's saying, look, I look this good because of all of this stuff I've had.
Right.
And implied in that is, if you don't feel you look as good as me, don't beat yourself up over because you haven't had all this stuff.
Right.
Like, and I think that's so important for generally the psyche for especially young women as they get older, because, Instagram is such a hard thing for women and their self-images.
I agree. I think from that level, it's like doing a public service. I completely agree with you. I also like the fact from, where we stand that there doesn't have to be such a stigma. Sometimes it's brought up with famous people, especially women. Oh, she had Botox or whatever. Okay, who cares? Like,
as a
so
negative
let people,
thing.
right, as a negative. And there's such a stigma, but like, we all know, like, we all want to age well. And so you do, you exercise to keep your body aging well. You eat well to keep, these little things that you do or bigger things you do to make yourself feel better and be your best self there shouldn't be a stigma about it.
Yeah.
There really shouldn't.
No, I agree. All right. Well, another treatment here, kind of interesting. This is an article by Jolene Edgar, who is a very prominent plastic surgery writer. The demand for non-invasive fat reduction is plummeting. The category of procedures, which includes cool sculpting and Kybella, is down by a dramatic 40%. The American Society of Plastic Surgeons' annual trend spotting report has arrived, plotting the popularity of plastic surgery and non-invasive procedures. Every year, it analyzes key shifts in aesthetic medicine. What caught her eye was a big number, the percent change from 2024 to 2023 in a negative 40% for one group of treatments. It's the data equivalent of a free fall, and it was attached to the number of non-invasive fat reduction procedures. Cool sculpting, Vanquish, Kybella, and the like, performed by plastic surgeons year over year. They fell from 745,000 in 2023 to 447,000 in 2024. What's most surprising about the drop-off, according to some doctors, is the sheer fact that it took so long to transpire. When posted on Instagram about the rapid decline, plastic surgeons replied with comments like, "Finally and thank God." Bob Basu, MD, a board-certified plastic surgeon in Houston, really nice guy. He actually went to college with my wife, Amy. And the president-elect of ASPS attributes what he calls the steep decline to both the GLP-1 boom and what he sees as the modern patient's bang-for-the-buck mentality. While every cosmetic intervention poses some degree of risk, cool sculpting has made headlines for its complications. One of the more serious risks of the fat-freezing technology is paradoxical adipose hyperplasia, which is marked by fat growth in treatment areas. A potentially devastating complication, PAH presents as abnormal bulges, usually hard, sometimes painful, and frequently shaped like the device applicator. Its victims typically see their treatment areas shrink as expected, but then, weeks later, grow bigger than they were pre-freeze. The only fix for PAH is surgery, energy-assisted liposuction, and/or tummy tuck to address the fibrotic fat, a firm type of fat that can be challenging to remove, and restore normal contours. The incidence of PAH is low, but thought by some to be underreported. So this article is basically saying that the American Society of Plastic Surgeons every year releases statistics for the year before of how many procedures that we did, how much they cost, and stuff like that. And most every year the procedures will go up just a little bit and stuff like that. But this year there was this huge decline in non-invasive or minimally invasive fat reduction treatments. Now, I know you have cool sculpting. Is that something that you've seen a decline in the number of people undergoing that treatment?
I have not seen a decline. I would say this, that I think there was a little bit of a drop when the supermodel, Linda Evangelista, came out and said she had some complications with it, and she had. But for the most part, I mean, I still do cool sculpting on myself. And so, we get a lot of internal referrals from patients with our practice from the internal dermatology side that ask us about it. And when I tell patients, and my partners do it themselves too, on their own body, and that it works for us. So, yes, there's this 0.05% chance you can get that PAH, where you get more fat, that you were explaining. But I still am a believer in it truly on my own body. I still do it on my own body. And so, internally, we're referring enough patients, I think, internally that...
Have you ever seen PAH with any of your patients?
And I still do it on myself, knowing that PAH can happen. Yeah. I mean, I also know I have you in case I get the PAH. It can help fix it. It is a fixable, not an easy fix, but there is a fix to it if it happens. And again, 99.95% of patients do get results or do not get that complication. That's enough for me to continue to do it on myself. And so I still recommend it for my patients, and they listen, and they really, we get good results for the right candidate. We've talked about that before.
So I've seen 2 patients with PAH. Yeah. Both patients, it was like really bad.
I remember you saying it was really thick and
I had, it was different. Yeah. I had a patient who did it on her submentum, on her double chin fat. And when she came to see me, it was huge. I mean, it was big. So I liposuctioned her. She was actually from up north, several hours away. And I never saw her after surgery. She went back home, had the sutures removed back where, up in the Upper Peninsula of Michigan, and never came back. But I did call her afterwards, and she said, "Oh, I'm really happy. It's so much better." But she lived with that for a couple of years. And then came down to see me. And I think I operated on her. It was like literally right after the pandemic. Like I think it was probably still 2020 that I operated on her. And then I had another patient not that long after that who had it of her abdomen. And she had just a huge thick area above her belly button and a huge thick area below her belly button. And that one I actually did a tummy tuck on her. And then she came back after it healed, and then I liposuctioned the rest of it. And you could tell the fat, like in this article explains the same thing. It's the fat, normally fat that you see is like bright yellow. That's what we see when of like virgin fat. This fat is like kind of a darkish yellow color. And it's almost like if you take fat and you leave it out for a long time and it turns kind of dry and darker yellow color, that's what it looked like. And it was definitely more fibrous. It came out just fine. And did not come back, but it's definitely a whole other thing.
It is. And I will say, and I do have skin in the game, so I do I'm not to say defensive about cool sculpting, but I do still believe in the treatment. And we have, the company does pay for that complication to be fixed. They do. They will pay for that if that is. And I have not had any of my patients. You haven't
seen anybody.
I have not, and I've had the machine. Yeah. I can't even count, at least 10, probably 10. I can't remember when it came out, but we've had it for a long time.
Because I know I saw one study where they were saying it was upwards of 1% of patients, but that must not be the case.
I have not.
The studies are all over the place.
Not seen it.
Yeah.
And whether a patient hasn't reported it to me or what, but normally they would.
Yeah, I'm sure they would.
Yeah.
They'd be upset. Yeah. So I have Sculpture, which is from a company called Cynosure, and that heats the fat. And that the studies seem to show it's a pretty similar effect as cool sculpting. So that's what we use.
But there's not that same potential side
risk
effect
of the PAH. That's why I got it. Yeah,
Okay.
because when I was looking at these devices, cool sculpting got really popular, and I held off on buying it just because I questioned whether it really worked.
Yeah.
And then by the time I was realizing that this thing really works, freaking everybody and their uncle had it. And I don't want to be the last guy on the street to get like a device, because what's going to happen is they'll come out with a new improved version like a month after I buy it.
Which they are. We talked about that.
So I ended up getting Sculpture, and then the pH stuff started coming out after that. And I was like, oh, thank God, at least something I don't have to worry about. But yeah, I can always lipo them if that's the case, but you don't want people to, it's just not something you want to deal with.
I know.
Yeah. Well, speaking about fat reduction, this is an interesting article from a friend of mine as well. Plastic surgeon warns about popular cosmetic treatment and compares results to a melted sandwich. It's a mess. A trendy cosmetic treatment might sculpt your jawline now, but it could spell trouble if you're eyeing a facelift later in life. That's the warning from Dr. Prem Tripathi, a board-certified facial plastic surgeon who said a popular non-surgical procedure used to dissolve stubborn chin fat could turn future surgery into a nightmare that looks a lot like your lunch. If you take apart a sandwich, the bread, the cheese, the meat, they separate from each other very nicely, he said in a recent TikTok video. But if you toast it, everything is melted together. If you try to rip it apart, it just tears. That is what happens when you do Kybella, Tripathi continued. So when we're trying to separate layers during a facelift that you're getting 20 years later, it's a mess. Kybella is a first-of-its-kind injectable used to reduce the appearance of submental fullness, also known as the dreaded double chin. It's a popular non-surgical alternative to liposuction, offering less downtime and a quicker recovery. Kybella's key ingredient, deoxycholic acid, a substance your body naturally produces, works by breaking down fat cell membranes when injected under the chin. This causes the fat cells to rupture and release their contents, which your body naturally flushes out, leaving behind a more sculpted jawline. Some people see improvements after 2 to 4 treatments, but many need up to 6 sessions to get the look they want. In some cases, the presence of scar tissue can increase the risk of bleeding, swelling, and irregularities both during and after a facelift. Tripathi mentioned he has observed similar effects on facelifts in patients who previously underwent a thread lift, another minimally invasive procedure that uses dissolvable sutures to tighten and lift sagging skin. Here's the honest truth. Double chins are a surgical issue, he wrote in an Instagram post. So what do you think about this? Does Kybella create a mess, makes the area look like a melted sandwich?
Well, First of all, why do we have to compare things to food all the time? I'm
Because
not
that's
quite
what we
sure.
do in medicine all the
It is
time.
what we do. It is what we do. Half the
Everything
things in
is-
dermatology are named after
Exactly.
foods, cherry angiomas, and
Yeah,
all these.
there
Oh
you
my
go.
God. Okay, so that just makes me laugh every time. But, obviously I defer to you if you're doing facelifts and you can tell if someone's had Kybella. I will tell you that I've done Kybella over the years. I would say that it's never been a super popular procedure. There's quite a bit of swelling after, kind of like bullfroggy after. Obviously, you can't really hide that area like you could hide, procedures on other parts of the body. And so I haven't had a lot of repeat customers with Kybella. They have it done like, yeah, it made a little bit of a difference. Was it worth the 5 treatments and the cost of it? Not really. And when patients ask me often about the neck, same thing with the lower eyelids. It's those 2 areas, like surgery. It's a tough area. We have radio frequency microneedling for the neck to give you a little tightening, but for fat
reduction?
liposuction, I'm not a big fan of the Kybella. I didn't see great results with it enough that
Do you
we
still
continue
use it,
to do
or
it. Not
do you have
really,
it?
not
Not
much.
really?
It's sort of phased out of my practice. People don't really ask for it much anymore, and I don't know. Do you see a lot of people, or do you get a lot of people that?
Here and there. I mean, do you do cool sculpting under? Do you have the cool?
We do
sculpting?
cool sculpting under the chin.
How much of a change do you get with that?
No, it depends. Again, the same right candidate. You can get some debulking if they have a significant amount of fat, but they can get some debulking.
Yeah.
As long as it's not just loose skin. But if they have a definite little fat pocket under there, it will debulk it. Probably not close to what liposuction can do. And then we used to say we'd clean it up with Kybella after, whatever residual was left over. We do some cool sculpting to kind of debulk it and then inject with Kybella. And I did do Kybella a couple times on the over the outer breast, over the bra fat that women are bothered by. And they get a little bit of improvement, a little bit, but not enough that why not just have surgery if it's really, I don't know. It wasn't enough of a,
Yeah, I think that, so I'm with you. I do Kybella, but not very much.
Yeah.
Here and there we do it. I think that there's certain people that it can work pretty well for, but first of all, and I know Prem, I've never met him before, but we've interacted on social media and DM'd and stuff. Nice guy. I always question when you have surgeons saying that you got to do surgery and non-surgical stuff isn't going to work.
Yeah, of course.
Because we have an ulterior motive because we make more money doing that. Now, I don't think that that's necessarily why he put this out there. I think Kybella has a bad rap, I think, right now. I think it's way too expensive.
It is expensive, right?
And they never reduce the price on it, although sometimes they'll be like, oh, if you buy four vials, we'll give you 2 free or something like that. And I just reduce the price of the stuff, make it cheaper.
Right.
Because you do need to do at least, I usually tell patients at least 2 to 4 treatments to get optimal changes. And then every time you do that treatment, you're going to get swelling and stuff like that. I've had some patients be very happy with their Kybella results. I don't recall ever operating on any of them, so I can't tell you, does it look like a melted sandwich inside? I have seen patients who've had, let's say, thermage, and they've had scar tissue from that. I've had patients who've had threads, they've had scar tissue from that. And that's something that in general, it doesn't seem to impact me surgically all that much. Kybella, I can see if you're injecting it all throughout the different layers, that it could really cause those layers to technically kind of scar together.
Yeah.
And that could make things more difficult. I just have not seen that in patients yet.
Yeah.
And maybe Dr. Tripathi has. I also agree with you. I do get patients who come in and they've got that little bulge of bra fat that they don't like. I have liposuction that before, but I don't find that it looks smooth after you lipo it.
Yeah.
When you get a scar from it. So I'm still recommending Kybella for those patients.
Oh, okay.
Because unless it's got really big where you got to remove skin, then you get a big scar there. I have found that when I've lipoed it, I just don't feel that it looks smooth afterwards.
Yeah.
And so those are people. So the people I recommend for Kybella are is a bra fat like that.
Yep.
And then the other group are people who have fat in the double chin area and they've got some skin laxity, okay, but they don't want to do anything like a lift, okay? Because some of those, if you do liposuction and they've got laxity there, you can't lipo a little bit at a time. And what I tell my Kybella patients in those situations is if I lipo you, I'm going to remove all the fat there and we're just going to have to see what the skin looks like afterwards. If we do Kybella, we can remove a little bit at a time. And when that skin starts getting a little bit loose, you don't like it, then we just stop.
Yeah.
And in those situations, I think it makes a lot of sense for some patients.
That does make sense.
Because it allows them then to be able to control what their result is. Now, if, however, they've got nice tight skin and they got double chin, then I would prefer to go with lipo because most likely that skin's going to retract and it's going to look fine. But it's that group of patients that have some moderate skin laxity, not enough to warrant doing a facelift, but also enough that it could potentially sag a little bit if you remove that fat. then I think the Kybella makes sense. And the other thing with Kybella is it's inflammatory. So you may get some mild skin retraction from it.
Yeah.
And so in those cases, I think it actually can make sense for some patients.
Yeah. Do you worry at all with doing that over the outer bra fat area with like from a breast cancer standpoint, or like that it would in any way
not in that area, but I never go into the armpit. I had a patient the other day ask me if I would lipo her armpit, and I'm like, no, because that's where all your lymph nodes are. Last thing you do is you lipo that, and then you got a swollen arm afterwards, and then we're in trouble.
Okay.
So no, the bra fat is just over the pectoralis muscle. It's that kind of little fat that protrudes when your arm is down, but it disappears when you lift your arm up.
Yeah.
That's what some patients ask for, and like I said, I have lipoed it before, and I've never really loved the result.
Yeah.
And so I do think Kybella is reasonable.
Okay, I'll
for
bring it
that.
back for
I
that
think
area.
Kybella's for that. I think for that skin looseness of the neck and fat, but not so loose you need a facelift, but not so tight that you could just lipo it and know you're going to be fine. And then the other group are people who've had, let's say, post-liposuction deformities. If they've been over lipo, they got lumps and stuff, then I do think Kybella, is a reasonable option to spot treat areas like that.
On a separate note, just because it's interesting, he was sort of saying this is a treatment that later on when you need a facelift. Do you find that with fillers, like when patients have had a lot of fillers, do you find that you can notice a difference when you're doing a facelift on them?
A little bit with certain fillers like Sculptra.
Okay.
But it's never really, I've never had an issue, post-operatively or intraoperatively with the patient that's had it, Now, I'm sure you probably experience the same as me. When you have patients who've, let's say, have had a lot of filler, and then you would try to inject them with the cannula, I find that some patients, you can't move the cannula into the skin because there's too much scar tissue from all the filler that they've had.
I don't use cannulas ever.
Oh yeah, so I use a lot of cannulas, and in those patients, and in patients who've had a lot of acne scarring, it can be really hard to pass the cannula through those tissues because I think the scarring.
That's a subcision technique. Actually, you could probably help their acne scarring.
Well, that's a whole other story.
I know it is. I'm just kidding. Anyway.
But yeah, those are the patients. But I have not seen, and I do a lot of facelifts, I've not had that be a big issue for me.
Okay. There's a difference between, injecting a substance versus that doesn't dissolve. Like a filler doesn't really dissolve anything like a Kybella would, or even like the biostimulator of Sculptra.
Well, I think that and I do think we're going to see more and more biostimulators. I'm waiting for the PDRN, the salmon DNA stuff, because that's really popular in Korea right now. At some point that could get FDA approved. And I think that's going to really start changing the game because people are getting more and more disenchanted with fillers.
Yeah.
And they're looking for something else other than neurotoxin to help turn back the clock.
Yep.
And I wonder here, two things. It's going to be the salmon DNA, the PDRN, if and when that gets FDA approved, and exosomes.
Exosomes, you've talked about that, yeah.
When that gets approved for injection, I think all of a sudden the game changes and people are really going to be looking at that. Currently here, we can't really do that legally, so that's not happening, but we'll see. Maybe 2026 is a year that stuff starts coming out.
And when all else fails, you can go in the biohacking atom ion
machine. You go. Yeah, get that regenerative machine. So Dr. Emily Levin, where can people find you? And if they want to see you for your services, how do they get a hold of you?
Okay, you can find me online. Our website is nw-derm.com. And then you can find us on Instagram and Facebook as well. It's northwestderm_covet med spa on Instagram and Facebook.
And she sees patients. She has a bunch of partners. You've got a huge practice in the Detroit area. Mm-hmm. Where's your location? Do you have one in Bingham Farms?
One in Bingham, Washington Township.
Oh,
Washington Township is our second location. Yep, and that's been really doing great. And kind of east side.
So if you're in the Southeast Michigan area, you're looking for a dermatologist, check out Northwest Dermatology. Dr. Emily Levin and her partners are great. We take our family there for our dermatologic needs. So thank you so much for joining me today.
Thank you for having me. I enjoy this every time.
Well, thank you everybody for watching and for listening. And as always, if you enjoyed this podcast, if you could leave a rating or review on iTunes or Spotify or wherever you get your podcasts, it does help us spread the word. And as always, my name is Dr. Anthony Youn. This is Doctor Youn Show. I will leave you with eat real food, use clean skincare, and auto-juvenate before you operate.